having an AOGS Golden Jubilee Oration to be delivered by Dr. Sabaratnam Arulkumaran sir. The topic of this particular Golden Jubilee Oration is Adolescent Health, Global Perspectives. We have three esteemed chairpersons for this particular oration. Let me introduce the first, the renowned President, Dr. Alpesh Gandhi sir, Dr. Rajal Thakur madam, President and the Ahmedabad AOGS Gynec Society, and Joint Secretary Foxy, Dr. Sunil Shah sir, who is also Honorary Secretary of Ahmedabad AOGS Gynec Society. I welcome all the three esteemed chairpersons for further proceedings. Thank you.
I request Dr. Alpesh Gandhi to give a welcome address.
Thank you, Dr. Rajal Ben. It's a respected Golden Jubilee orator, dear office bearers, and all dear colleagues. A very good evening to all of you, and a good afternoon to Sir Sabaratnam. It's a pride, it's a pleasure and pride to welcome Professor Sir Sabaratnam Arulkumaran to our own Ahmedabad Obstetric and Gynecological Society. Sir, you are one of the most lovable and respectable faculty orator for Ahmedabad Society since so many years, and I think you have many frequent visits of Ahmedabad Society. I think in the month of on 7th February exact date we met at Mumbai during the Mumbai conference, and we were discussing about your oration and visit at physical visit at Ahmedabad on 26th of the June for this oration. Unfortunately, physical visit could not become possible because of COVID. At that time, we were not knowing about COVID, and it has taken shape like anything. But still, it's good that President Dr. Rajal Ben could make it possible, this oration by virtual platform, and Ahmedabad Society is fortunate to have you for this oration. Your physical visit will remaining, and once COVID situation will be under control, we will not leave you, and you have to visit Ahmedabad Society. This is very prestigious oration of Ahmedabad Gynec Society, and I am happy to inform you, sir. You must be happy to know that Ahmedabad Society established before independence of India. So Ahmedabad Gynec Society established in 1936, and after 50 years, in 1986, Golden Jubilee Trust was formed and this oration was started. And since last 50 years, we have very, very eminent faculties across the world for this prestigious oration. In 1986, we have Dr. Roger Basley from UK. We have Dr. Shodamini Pandya from Ahmedabad. We have Dr. Motasra from Mumbai, Dr. Sadhna Desai from Mumbai. Then we have Dr. Usha Krishna from Mumbai, Dr. Behram Anklesariya from Ahmedabad, Dr. Professor John McBain from Australia. We have Dr. Sajida Zaidi from Pakistan, Dr. Rashid Latif from Pakistan, Dr. Yep Lip Ki from Singapore, Carlo Di Renzo from Italy, and we have our own VP Piley sir then Juan Garcia from Madrid, Professor Howard Carr from Israel. So many eminent faculties across the world from different countries have delivered this prestigious oration. And today, Ahmedabad Society is fortunate. It's a proud moment for all of us that we have a very eminent orator for this prestigious oration of Ahmedabad Gynec Society, Professor Sabaratnam Arulkumaran sir with us, from whom I have learnt a lot, and probably maximum number of gynecologists across the world admire you a lot. So with this, I hand over mic to Dr. Rajalben for the introduction of sir, with promise from you that you will visit Ahmedabad Society when COVID will be over. And we hope that the situation will come soon. Let us hope for the best. Thank you very much for accepting our invitation. Thank you very much for joining with us for this prestigious oration. Thank you, sir.
Thank you.
Thank you, Dr. Alpesh Bhai, for your kind words. And I would like to share my screen. On behalf of AOGS, I welcome you, sir, Professor Arulkumaran, Dr. Alpesh Gandhi, AOGS office bearers, SOGOG members who have joined us, and also the members of FOXY who have joined us. Because I have been receiving several messages from the adolescent committee also that they want to attend this oration. So I'm sure they are with us in the audience link. So I welcome you all, and I welcome all the delegates and my office bearers. Few of the old golden memories, sir, with you when you came to Ahmedabad for the MMCon also, you came to Ahmedabad for the AICOG and also for the critical care, and today virtually for the 4th time. And as Dr. Gandhi has said, you have to come again physically when the COVID situation is under control. These are the few pictures of Gandhi Ashram that we went in 45 degrees centigrade heat. I mean, it was very harsh summer, but you had a keen interest and you had enjoyed the moments with Mahatma Gandhiji's ashram and his writings. And I also fondly remember that you had given me this book that is edited by you, and it has been on the adolescent and pediatric gynecology, and it was you as the editor-in-chief. And I'm so happy to show you that I still have that book with me. This is the book and the autograph that you have given me. So it is my proud possession. The team 2020-21 AOGS has got the theme. Every year the AOGS gets one theme and the motto. And the theme for the current year is on adolescent, because I have been working a lot for the adolescents. And the theme is the catch them young and teach them right. So in continuing that theme, today's topic has been decided. We all know that it's a transitional phase of growth from between the childhood and the adulthood. WHO defines it as any person between the age of 10 to 19, and young adults are between 10 to 24. India is having one of the largest population of adolescents across the world, that is about 243 million, which comprises of about 21.3% of total population. And the young adults are about 350 million. If we see the characteristics of the adolescent and this acronym, we have seen the adolescent is he's aggressive, anemic, abortion problems are there. Adolescents are very dynamic, they are developing, yet they are having lots of mental health issues. They are overconfident, they just don't know what will be happen when they do so much of experimentation, overindulging, obese, loud but lonely, lack of information, enthusiastic, explorative, experimenting, They are social, have got sexual problems, spiritual problems, courageous, cheerful, and concerned. They are emotional problems, and they are nervous, never say no to the peers. They are temperamental and problems with the teenage pregnancy. With these characteristics of the adolescents, the topic of today's oration is Adolescent Health Global Perspectives by none other than Sir Arulkumaran, who is PhD, DHC, FRCS, and FRCOG. His Professor Emeritus OBGYN St. George University of London from January 2013 after he retired from his position as Professor and Head of OBGYN from 2001 to 13. He was a founder professor of OBGYN at St. George Medical School, University of Nicosia from 2014. He is a visiting professor of Institute of Global Health Policy Innovation, Imperial College London from 2012. And he has been past president of the FIGO, that is International Federation of Obstetrics and Gynecology from 2012 to 2015. Past president of British Medical Association from June 13 to June 14. And past president of Royal College of OBGYN, RCOG of UK from 2007 to 2010. He was appointed as a Knight Bachelor by Her Majesty Queen of UK in her birthday honours list in June 2009 in recognition for his services to medicine and health and care. So with such an eminent and very well-read, having so many degrees, we are looking forward to your oration, and we are so happy, we are so privileged to you have accepted our invitation, and over to you, sir, for your oration. Thank you.
Rajal Ben, sir is the most humble person we all have ever met. And he is always very prompt on communication email. We all must have experienced that within few hours we are getting reply from him. He is so humble, so communicative, and he is always ready to give any help, any support, any guidance whenever we require. Sir, we are thankful to you. Thank you for joining, for accepting.
For this oration communication also, I just sent him an email and he was more than happy to say yes, and then it was just a matter of time that we need to decide the date as per his convenience. So we are happy to have you, sir. Over to you, sir.
We have to learn from you how you can do this, but this is amazing. Within few hours, you are always there with us.
Thank you. Thank you. Thank you very much to Dr. Alpesh Gandhi, President of Foxy. It's a great pleasure to see you as a friend and colleague. We meet at different places, and unfortunately we are meeting and stretching our hands thousands of miles, and very nice of you to say the kind words. And also to Dr. Raja Thakur for the kind introduction. And I was very impressed with the adolescent, each letter indicating the characteristics of the adolescent. So it is very well describing the adolescent. And thank you. I still remember my visit to the Gandhi ashram many years ago, and it was very kind of you to take me around. And also to Munjal Pandya for making all the technical arrangements with me, and to Sunil Shah, of course, for coming and joining us today. So it's my great pleasure to be with you across the miles from London to Ahmedabad. So the topic is adolescent health. So I'm going to share my screen. And I think the technology is working all right. And so the theme was catch them young and teach them right. So I think it's a very important theme. So I do not have any special expertise in adolescent health, except I join meetings at the WHO and FIGO and other organizations to discuss about it. So I have knowledge, but not clinical experience in managing those issues. So I have also discussed with Professor Hamid Rashwan, the former chief executive of FIGO, to get some points to produce my talk on the global issues. And I consulted the WHO and they sent me this document, which is available on the website if you put WHO and adolescent health. And they met in 2017 and made some guidelines, which was approved by the WHO Guideline Review Committee. So quite a number of, a lot of facts and material are from the WHO document because it is a global issue. I thought I'll take it from them. Now, this is the summary from the working group in 2017. As mentioned by Dr. Rajal, the age group is 10 to 19 years, but these are the problems they face. At least 10 million unintended pregnancies occur each year among adolescents between 15 to 19, especially in the developing world. And complications during pregnancy and childbirth are the leading cause of death for 15 to 19 years of age globally. And over 1 in 5 young women of the world are married between age of 18, the highest prevalence being sub-Saharan Africa. So the childhood marriage, which is not uncommon to even some of the Asian countries. Every 7 minutes, somewhere in the world, an adolescent is killed in an act of violence. So that's terrible, getting a child killed in the age group between 10 to 19. And suicide is the third leading cause of death among 15 to 19. So that is also tragic. So childbirth is one, suicide is one, violence is one. And 10 to 20% of adolescents globally experience mental health, as was mentioned by Dr. Rajal. Mental health conditions is also very much prevalent in these adolescents. And in 31 countries for which there are nationally representative data, about 1 in 3 girls aged 15 to 19 have undergone genital mutilation. So you can imagine the toll of disease and death among the adolescents. So this is a formidable group. And I was just staggered by looking at the numbers of adolescent children in India. So India needs more help with adolescent health, with so many adolescents, nearly 25% in that age group. Now, this figure might be a little bit too small for you to observe, but essentially it says intergenerational effect of parents, and there is always an equity gap preconception, starting from preconception. Now, the upper border gives the protective factors, and the lower orange gives the vulnerability factors at different age groups. And if you go towards the adolescent, then it starts with child labor, commercial exploitation, child marriage, adolescent birth. These are the ones. And what can keep them out of this mischief is support of early adolescent and child development, immunization, school achievement, parity in education, safe learning environments, and improvement of literacy. So if a child is in school, in other words, that means the parents would be empowered to send them to school. They will have some economy. The child does well. Once the child doesn't go to school because of poverty at home or because the child is not looked after well and gets into bad habits, then the adolescents suffer mostly. So it's a very vulnerable age group. So we are going to look at what are the vulnerability. So in terms of looking at vulnerability, I'm going to give you a general overview and then go through these problems and discuss what is the magnitude and whether the international community has recognized this problem or are we keeping quiet about it? And what are the global policies about young people and adolescent sexual and reproductive health, facts, figures, and special challenges we face, and information, education, and support adolescents have, and something about adolescent pregnancy, and finally about contraception, abortion, and sexually transmitted infection, including HIV/AIDS. So contraception, abortion, and sexually transmitted diseases are things which they should be able to confide in confidence with supporting health caregivers so that they can get the best when they are faced with these situations. And of course, there are special concerns of early marriage, problems in conflict zones, female genital mutilation, and so on. And I will conclude what the decisions of the WHO is. So in terms of general overview, most young people are healthy. However, more than 2.6 million young people aged 20 to 25 die each year. So when we consider maternal mortality, for example, we are talking about 300 per 100,000. That is the maternal mortality ratio. So if you really look at how many women altogether die, we are talking about 500,000 and so forth. Compared to that figure, this figure is very staggering, 2.6 million in that age group. And a greater number, much greater number, suffer from illness which hinder their ability to grow and develop to their full potential. So what are the illness we are talking about? And that is due to lack of protection against sex and contraception, sexually transmitted infection, and also bad habits which they pick up. And these are what they are. So a greater number still engage in behaviors that jeopardize the current and future health. So when they get into bad behaviors, not only the current health, but future health is affected. Nearly 2/3 of premature deaths and 1/3 of the total disease burden in adults are associated with conditions and behaviors that began in their youth, like tobacco use, drug use, lack of exercise, unprotected sex, or exposure to violence. All these bad habits, they pick it up in the adolescents because of certain peer pressure also in schools, so they pick it up. But if they don't go to school, it's very easy to get mixed up amongst people on the street and run into problem. And if you look at the problems in the UK, United Kingdom, and also in the United States, there are street deaths, or fights between gangs, something to do with drugs and dealing with drugs and so on. So it's a major problem when you're talking about tobacco, drugs, unprotected sex, and exposure to violence. And further jeopardized by child labor, early marriage, trafficking, domestic and sexual abuse. So if the parents cannot afford to bring up the child, sometimes they give the child to do some labor, either in a factory or an estate or in a house, and they can easily get sexually abused or domestically abused. And sometimes they get trafficked. And in some communities, early marriage, that causes problems because it's usually to an older man and the whole family can abuse her presence. So promoting healthy practices during adolescence and taking steps to better protect young people from health is critical to future countries' health and social infrastructure. Because if you want everybody to be productive and also to help each other and the country, then we have to look after them when they are adolescents. So prevention of health problems in adulthood can be done by prevention of problems or getting into bad habits or even mental illness as an adolescent. So you prevent something in adolescence, that'll benefit in the adulthood. So the magnitude of the problem, more than 2.6 million young people between 10 to 24 die each year, mostly due to preventable causes. As I mentioned, is homicide, suicide, which can be mentally retarded, mental diseases, or what you call as psychiatric illnesses of some sort. And about 16 million girls aged 15 to 19 give birth every year. So that is the predominant cause of adolescent death, which is predominantly girls and associated with childbirth. Young people 15 to 24 accounted for 40% of all new HIV infections among adults in 2009. The figures are being revised, but it is not much lower. It is almost in a similar proportion because adolescents are exploited by older males and those who can have HIV and pass it on. So any given year, about 20% of all adolescents will experience a mental health problem, which I mentioned, most commonly depression or anxiety. And one of the common themes about mental problem or mental health problems and suicide is because they don't take a premeditated type of committing suicide. They suddenly kill themselves by jumping in front of a train or jumping off a big building or set themselves fire and so on. So it's very traumatic when you see how they commit suicide as well because of mental disorder. An estimated 150 million young people use tobacco. So tobacco use becomes a habit when they're adolescents. And 430 young people aged 10 to 24 every day through interpersonal violence, so which I mentioned might be drug-related, drug trafficking related, but it is interpersonal violence, or mainly gangs between two groups or few groups. Road traffic injuries cause estimated 700 young people to die every day. And that is because either on one extreme, they are driving without a license and after alcohol, intimidation, and so on, not only killing themselves and the people on the road, but on the other hand, they are finding it difficult to sleep in a proper place. They are lying down next to the streets and railway stations, and they get accidentally killed, right? Road traffic accidents. So either way, the injuries and deaths are very common due to accidents. Now, internationally, this has been recognized as early as 2002. The UN General Assembly Special Session recognized the need for development and implementation of national health policies and programs for adolescents, including goals and indicators to promote their physical and mental health. So much so, when they formulated the Millennium Development Goals, they had important framework for young people, and two of them were directly relevant to our field of obstetrics and gynecology. And one is to do with improvement of maternal health. The other one is to do combating sexually transmitted diseases, mainly HIV and AIDS. And this has been rolled into SDG 3. The aim is to achieve universal access to reproductive health. And one of the indicators is the pregnancy rate among 19 up to 19 years old. Now, MDG 6, which is rolled into SDG 3, aims to halt the spread of HIV/AIDS as one of the indicators. And they want to achieve a 25% reduction among young people, and also measures the proportion of 15 to 24 with comprehensive and correct knowledge of HIV/AIDS, because a lot of youngsters, young adolescents, they don't have much knowledge about HIV/AIDS. And this is continuing from MDG to SDG. So there are global policies for young people which the governments had to formulate. So if you go into a health ministry, there must be somebody in charge of adolescent health, somebody who has definitive policies for the government. Because in 2003, the Committee of the Convention of Rights of the Child issued a general comment in which the special health and developmental needs and rights of adolescent and young people to be recognized. So each and every government should know that. I have met ministers in different countries, and if I ask them about sustainable development goals or rights of children, rights of women, they just look at the ceiling because they have no idea what we are talking about. So it's quite important as a profession for us to remind them what are the importance and what are the Convention on Rights of Child and what they should do as a government. These are supported by Convention on the Elimination of Discrimination Against Women and the right to health, because the women and girl child gets more affected when it comes to the right of the child. So what are the facts and figures? I think Dr. Rajala has already mentioned, we call adolescents as 10 to 19 years old, early as 10 to 14, and late as 15 to 19. The 15 to 19 fall into a lot of groups of smoking, taking drugs, violence, sexually transmitted infection, and so on. They are in a vulnerable age group. And the youth is a little bit broader group from 15 to 24, and young people is 10 to 24. But these are no artificial separation. The one goes into the other. So more than 1.7 billion people are between the ages of 10 and 24. And 86% live in less developed countries, and more than half live on less than $2 per day. So if we want to improve adolescent health, there are two basic tenets. One is education, second is empowerment, so that they can be empowered to defend themselves and also to make a earning, if possible, if they are nothing else to do once they pass an age group of 16, 17 years of age. So the experience of young people to navigate their transition to adulthood safely and successfully is diversified by age, sex, marital status, schooling, residence, migration, and socioeconomic status, amongst other characteristics. So there's a group of things which will influence their health: child marriage, female genital mutilation, harmful traditional practices, lack of knowledge of and experience sexual education, high-risk pregnancy, HIV, sexual abuse, assault, stigma of impacting health knowledge-seeking behaviors, and abduction. Now, this is what happens to the adolescent, and these will be influenced by the features shown on the right: age, sex, lack of social support, marital status, economy, rural or urban community, education, and so forth. So the better the social structure, better the economic structure, better the level of education. If there's no conflict settings, then they do better. But if they are in conflict settings, they have to migrate. If they are in a rural settings and so on, they get rural or urban sometimes, they can get violation of their own rights and health. So what do we know about adolescents? Their health and well-being is linked to the social, cultural, and economic environment. There is no question about that. The social cultural construct will influence their health. In all regions, they are reaching puberty earlier and marrying later so that they are sexually mature for longer before marriage. So in other words, they are getting puberty, but they are not getting married like earlier days at age of 19, 20. They get married at 25, 30. So they have a long exposure period where they might run into trouble. Their sexual experience varies across regions. However, within regions, key aspects of adolescent sexual and reproductive health are relatively consistent. So the problems encountered in South Asia, for example, or Central Asia, has certain issues because the culture is confined to that area. Similarly, in sub-Saharan Africa, the culture determines what they're going to do. So the differences between groups, urban, rural, in school, out of school, one parent family, whether they are girls and boys, will influence the access to care and source of education, information, and support. Because if they are girls, they are generally kept behind at home in many countries to look after the family and to clean the kitchen and to cook and so on and so forth. So they lose out on the long run. And main risk factors affecting health outcomes are early sexual initiation, substance abuse, depression and ignorance, and the non-availability of contraception. So it is our responsibility in many ways as professionals to provide information, education, support. Information must recognize the youth's diversity, age, gender, marital, and migration status. The most effective intervention enhance factors that protect them from harm. So as professionals, we have to see how we can defend them running into harm. And information should provide information on protective factors, advising parents and the community about the importance of education and schooling, and the importance of family unity and also the community support, and enhance the beliefs and values of looking after adolescents. And societal openness facilitates pragmatism. So you have to really talk about the sexual activity and how can you prevent and so on. If you don't do that in schools and provide education and warn them and also have someone like a school nurse to whom they can confide and talk and keep it in secrecy, then there will be more problem compared to benefits. So the single most important barrier to care is provide attitude. So not only us as doctors, but also nurses, midwives, they should be put in charge in a special clinic like a school clinic where the girls can go and confide. Even boys, they might have problems to discuss. In many societies, adolescents have difficulty accepting sexual development as a natural and positive part of growth and maturation. Now, this reminds us about what we call as menstrual poverty, when young girls don't have even enough protective sanitary wear, and how the parents react, especially the father, to this calamity. So the lack of confidentiality, embarrassment, and feeling that they are not taken seriously or respected deters them from using services. So if there is a school clinic or an adolescent clinic or adolescent specialist, confidentiality is very important. They should be treated with dignity and empathy so that you understand their problems. So, however, even if there are no facilities, it does not deter them from having sexual intercourse, because that is something which they get involved by seeing a girl seeing a boy, or boy seeing a girl, they get involved and thus expose themselves to unnecessary risk, in addition to coercion by elderly males in the society. So there are many problems associated. So information, education, and support is a major barrier. And in accessing, if you have, accessing information is difficult, then they run into problem. So accepted early marriage and childbearing, migration, urbanization, media, peer pressure, all that has to be looked into by organizations. Personal barriers, fear of parents or community knowing, that is a major problem preventing adolescents seeking help. And also violence and concern about side effects if they are using a contraceptive. And service-related barriers, and the most important is the cost, the location. They don't want to go to the same hospital where they can be identified as so-and-so's daughter or so-and-so's sister. And also it should be youth-friendly, and judgmental attitude should be thrown out, and they should be treated with confidentiality, and enough supply should be made available. So successful interventions are, we have to know what adolescents are doing and what they are thinking, and we must respect their diversity, because the one adolescent will vary so much from another adolescent. And exploring parent and teacher attitudes. If an adolescent comes, then we have to ask them questions about how the parents are treating, how the teacher is teaching, any problems there. And encouraging leadership and self-confidence. We have to tell them that is something they will overcome in a short time, and these are the things they have to do. Using media effectively, and I think India does, the Foxy does use the media effectively, and that has to be used as much as possible by the different societies of Foxy. And meaningful community involvement. So we can't work in isolation as healthcare providers, but we have to work with social care providers, educationists, and go to the schools and or a weekend give some lessons about sexuality, contraception, abortion, child health, understanding the social environment, and building capacity of local stakeholders. So there will be a lot of voluntary organizations who will be willing to help, and effectively to utilize information with the broader community and share them with the adolescents. Now, the MDG was in part related to adolescent when it comes to maternal mortality, because 2015, the target 5A was 3/4 the maternal mortality ratio we wanted to reduce. And 5B was universal access to reproductive health. But in these two categories, adolescents face the higher risk of complications and death as a result of pregnancy than older women. They get more chance of getting preeclampsia, and they can be anemic, they can die of postpartum hemorrhage, and so forth. 16 million women 15 to 19 years gave birth each year, and around 11% of all births worldwide. So it's not a small problem, it's a significant problem. And 95% of these births occur in low and middle income countries. And there are important regional differences. Births to adolescents as a percentage of all births range from about 2% in China to 18% in Latin America. So there's a lot of regional differences in terms of adolescent pregnancy and childbirth. And pregnancy among young mothers is a significant problem in low and middle income countries. And sub-Saharan Africa, South Central and Southeastern Asia are common issues with adolescent pregnancies, and we have to protect them. And the context of pregnancies vary. They can be unintended, and they can go for induced abortion, which can turn septic, or they can bleed to death. Coerced sex is another important issue which brings them pregnant. And the first sex before the age of 15 contributes to unintended adolescent pregnancies and leads to abortions quite a lot. Now, it is dangerous for the mother because she can be anemic. They are more prone to malaria, HIV, other sexually transmitted infection, postpartum hemorrhage, and depression. And 2.5 million adolescents have unsafe abortions every year and are more seriously affected. And obstetric fistula in some of the sub-Saharan Africa, 65% are to adolescent mothers. So you can imagine the toll of an adolescent having a childbirth. And 50 to 100% more frequent, the deaths within the first one. This is about the child. If an adolescent gives birth to a child, they have a higher mortality. And incidence of preterm birth, low birth weight, and birth asphyxia also increases. And pregnant adolescents are more likely to smoke, use alcohol, and this can cause problems for the child and the childbirth. So there is a lot of connotations, not only for the mother, but also for the child, and also connotation for the community. So not only mother and child, but also for the community, because it can compromise educational achievement. If she gets pregnant, she can't go. And if she can't go for education, it affects the economic potential. So she has to leave school. So it has long-term implications because she might not get back to school because she has to look after the child. So delaying adolescent births is quite an important agenda for us, and we should really promote contraception in the adolescents. So families and communities need to support adolescent mothers by providing help and acceptance and ensuring home-based care. And information should be disseminated about how to overcome emergency situation. And there should be improved access to information on education, family planning, and the ability to deal with domestic violence, which is also quite an important issue in adolescence. So what can the health workers do? Of course, they can start the antenatal care early and provide them with good advice and what are the legal norms. Respond to specific problems like anemia, malaria, HIV, and sexually transmitted infection. Because depending on who the partner was, we had to screen for sexually transmitted infection and help to develop birth plans for these adolescents. And you have to give special attention for those under 16 during obstetric care because their pelvis may not be well developed. They are more likely to have obstructed labor, fistulae, or stillbirth or problems related to that if you don't take care. And special support following delivery regarding feeding and care issues, feeding of the baby and care issues. And you have to really develop skills and services to prevent future pregnancies. So postpartum contraception becomes an important issue. And also as a group, as a society, you have to analyze the statistics in your own location. And you have to develop skills of health workers to deal with special clinical and psychosocial needs. And if there are legal and policy environment which are not healthy, we have to see how we can modify so that they can really get the best care. Now, these are very worded documents. I won't go through that in detail, but these are from the WHO. Number one is reduce marriage before the age of 18, because that they are found as a major problem. So we have to really think of interventions and empower girls and families and societies not to get them married before the age of 18. Secondly, you have to reduce pregnancy before the age of 20. So advocate for adolescent pregnancy prevention amongst all stakeholders by providing information on sexuality and health education, life skills, and maintain and improve effects to retain girls in school, because if they're in school, then the chance of getting pregnant will be less. Offer interventions of sexuality educations and promote postpartum, post-abortion contraception if they got pregnant and they have miscarriage or at birth. And increase the contraception for adolescents at risk of unintended pregnancies. So you have to talk to the community to see how we can increase contraception, including routine contraception and emergency contraception. It is much easier to provide them with emergency and contraception rather than trying to treat a pregnancy or contribute to an abortion. There are other issues, which is one is contraception, as I mentioned, because the knowledge is lowest in sub-Saharan Africa, but also it's the same in other countries. And use of contraception by sexually active teenage girls is 2% in some of the sub-Saharan Africa, like Niger, Rwanda, Senegal, 11% in Latin America, and 34% in Indonesia, and 75% in the US, and 88% in France, and 92% in Britain. So reported condom use by those at higher risk is low in most countries. So even though they are getting sexual intercourse with partners whom they don't know very much, and especially female adolescents have used a condom, fewer of them have used a condom than males. And they rely on primary and secondary abstinence. Primary abstinence is never had sex, and secondary abstinence is they had sex but have not engaged intercourse for the last 12 months. This is a very common practice in sub-Saharan Africa, but this is not at all reliable. And we had to tell them that abstinence is something which is not possible, because they might get into a corner where they might be emotionally keen to have sex and they can't prevent it. And they can have even coitus interruptus is not a safe method for contraception. So abstinence programs are not effective at delaying sexual initiation and reducing teen pregnancy. And what is effective is providing accurate, balanced sex education, including information about contraception and especially about condoms, especially at that young age, because they don't know with whom they're going to have sexual intercourse. Coming to abortion, adolescent birth rates are closely linked to rates of spontaneous and induced abortion. Worldwide, mostly as a result of unintended pregnancy, 4.5 million adults undergo abortion each year, 40% under unsafe conditions. So you can imagine, because these adolescents don't want to be identified that they're going for an abortion. So they go to any backstreet abortionist in another village or another city, and they run into trouble. So in countries where abortion is restricted, unsafe abortion causes up to 30% of maternal mortality. And of course, now it is becoming less amongst educated adolescents, because they say the genie is out of the bottle. The genie is misoprostol and mifepristone, where they can get it over the post by DHL or some other means. So unsafe abortions vary substantially across regions, and 19 years old account for 25% of all unsafe abortion in Africa. So we can say adolescents contribute a significant amount to abortion, mainly illegal abortion. So where abortion is restricted and difficulty in accessing legal abortions, we have to make sure that they get post-abortion care services like contraception. Those countries where they have allowed abortion to take place, legal abortion, like the UK, the France, Turkey, their legal abortions, once it is promoted, the number of total abortions have come down because the legal abortion places provide post-abortion contraception as well. So this is again WHO recommendation: reduce unsafe abortion amongst adolescents, ensure laws and policies enabling adolescents to obtain safe abortion. As I mentioned, if it is under the law, then they get contraception, so they won't get pregnant again. And enable adolescents to obtain safe abortion information and explain to them about dangers of unsafe methods of interrupting pregnancy, and make sure that the safe abortions are made legally available. Sexually transmitted infection is another problem, because they might run into trouble with having sexual intercourse with somebody not known, and you have to teach them ahead of time before they run into this problem. And valid data on STIs are limited, but it seems large proportion of STIs occur in people less than 25 years of age. And adolescent girls have a higher rate of STI than boys, and often have older partners and are biologically more vulnerable. And at the highest risk are adolescent sex workers, because they are trafficked sometimes and they run into trouble. Treating STI is essential. They facilitate the transmission of HIV. So if there are some STI, then they can get. So you have to make sure that the prevention starts at school level and integrated adult clinics, adolescent clinics, so they can go in. And HIV/AIDS is a huge threat in all regions. Sub-Saharan Africa and Caribbean runs the most risk, but the other Asian countries are behind, but still there are in some of the Asian countries. 45% of all new infections are in young people. And young men are better informed than young women. So I think we have to educate girls, especially the risk of HIV and the long-term outcome, how they are to be on lifelong drugs and how it is going to affect their health. And young women comprise 57% of all those who get HIV in sub-Saharan Africa. So it's quite important for us to really educate them about this major problem of HIV. And the majority of people newly infected are from 15 to 24, and girls are 5 times more likely than the boys of their age to become infected. So there are recommendations from the WHO about behavioral interventions and sexual counseling and support, because if it starts in school, then it is so much the better before they leave the safe environment. and also can use the opportunity, if facilities permit, to give HPV vaccine, so you're preventing later development of cancer. And special concerns are early marriage, which is not an uncommon problem in India or Pakistan or Bangladesh. So we had to look at that, because the problems of early marriage includes removal from school, isolation, STIs, HIV, potentially negative health outcomes for the mother and child if they get pregnant. And in conflict and post-conflict zone, there are special concerns for adolescents, because here again, when they are displaced, they are more likely to get violent attacks, rape, lack of rescue, and lack of schooling, more risk for STI and HIV. So wherever there is a big community of displaced population, there should be an adolescent clinic, maybe organized by the National Organization of ONG along with the government. Like in Cox's Bazar in Bangladesh, they need a adolescent health clinic so they can look after. Special problem in Africa is female genital mutilation, because that is rampant, and 1 in 3 girls get a female genital mutilation. But there's a program of accelerated abandonment to reduce FGM and its consequences. So in concluding, I think we have to think the adolescents need good health, adequate nutrition, because 40% of the bone is formed when they are adolescents. So if you don't give them adequate nutrition, then there is no point worrying about them at menopause, saying they have osteoporosis, because the bone formed when they are an adolescent with good nutrition is quite important. Responsive relationship and connection. This starts with family, society, and community. So they have to make sure they have a community set up, and they must have security, safety, and supportive, clean environment, so they grow in a healthy environment. And opportunities for learning and education. Keep them in school. So if there's something which somebody tells every single parent, keep them in school, keep them in school, keep them in school, and educate them on sexual and reproductive health, that itself can win the battle quite a lot. And realization of autonomy and resilience can be built up by education and empowerment. So in summary, I just gone through a general overview, the magnitude of the problem, the global policies, and the importance of information, education, and support, the specific problems caused by adolescent pregnancy, the side problems which can be caused because of lack of contraception, more septic abortions, STIs, HIV, and special concerns about early marriage, conflict zones, and female genital mutilation. So strong family support, education, empowerment is quite crucial. So with that, I thank you for your kind attention. It's a little bit long lecture, but thank you for your patient listening. Thank you.
Thank you so much, sir, for this wonderful oration. I invite Dr. Sunil Shah, sir, to read out the scroll for this particular oration. And I invite all the 3 esteemed chairpersons to present memento and scroll to Dr. Sabaratnam Arulkumaran, sir. Thank you.
Sir, thank you very much. It is a really excellent oration which you have given on adolescent, a global perspective. Our president, Dr. Rajal Benz, has decided to have a theme, catch them young and teach them right. And so it is not only the problem of India, but it is a global problem. So if they are taught and treated emotionally and educational wise, then the whole globe, the world will be good. So catch them young and teach them right. So on behalf of AOGS, I, Secretary Dr. Sunil Shah, will read your citation on behalf of all the team, our President Dr. Rajal Thakur, Dr. Alpesh Gandhi, respected Foxy National President Munjal Pandya, who is here, and the office bearers of Ahmedabad Obstetric and Gynecological Society. So, sir, this is a wonderful citation for you, which I am reading for you on behalf of all of us. Ahmedabad Obstetrics and Gynecological Society feels honored and has pleasure to award AOGS Golden Jubilee Oration for the year 2020-21 to Sir Sabaratnam Arulkumaran, who is PhD, DSc, FRCS, FRCOG, on 26th November 2020, Thursday, and on the subject of adolescent health, global perspective. The signatories are President AOGS, Dr. Rajal Thakur, and myself, Dr. Sunil Shah. Thank you, sir. This is a citation for you, and we have selected a wonderful memento for you. So I request President Dr. Alpesh Gandhi, National Foxy President, and Dr. Rajal Thakur, President, Ahmedabad Obstetric and Gynecological Society, to present a beautiful memento for you, sir.
Thank you very much. Thank you. Thank you for the kind words and the memento. Greatly appreciated.
So, sir, this is your photograph with
Thank you. Looks very nice. Thank you very much. Very kind of you.
Thank you, sir. So,
yeah, I invite again Dr. Sunil Shah sir to continue with a vote of thanks and a few words from Dr. Alpesh Gandhi sir and Dr. Rajal Thakur madam before we conclude.
So, sir, thank you very much for coming and sparing a time for the members of the Ahmedabad Obstetric and Gynecological Society. I thank respected Dr. Alpesh Gandhi for coming and blessing us, and Dr. Rajal Thakur, Dr. Munjal Pandya, all the office bearers of Ahmedabad Obstetric Gynecological Society, and our technical team, who is led by Rusil Soni of Enla Sikod. Thank you very much. Now I request Dr. Alpesh Bhai and Dr. Rajal Ben to conclude.
Thank you, Professor Sir Dr. Sabaratnam Arulkumaran, for the excellent oration. We will cherish this oration for many, many years. You have nicely covered so many aspects, from overview to the magnitude of the problem, and at the end, solution like counseling, care, education, empowerment, sexual education, and parenting. All these things you have nicely covered. So thank you very much to give justice to this difficult topic but you have done excellent presentation and cover all these aspects. Thank you, sir, for sparing your valuable time and enlightening us with this, with your wisdom and your knowledge. Thank you.
Thank you very much. Thank you for the kind words.
Thank you, sir, for coming and giving your oration, and AOGS will always cherish. This oration will be there on the YouTube link and Facebook page of AOGS. I shall be sharing the link with you so that you can also share with your colleagues and the friends. So it will be there on the websites, on the web pages of the YouTube. And as rightly said by you, that adolescents are the very important group of people, because if their health is good, our future is also secured. The world's future is also secured. So we need to give a proper concentration and help them for any problem. So it is our responsibility also to take care of them. Thank you very much. And thank you all from my team AOGS, Sogok, Foxy, and team Rushil and Enlasikot Technology. Thank you so much.
Thank you. Thank you very much. And all the best.
Thanks, sir, for coming. And we are waiting for your physical presence also, as and when the situation permits. So we are always welcome to Ahmedabad. And
so
we shall
only the year will be changed. It will be 2021, nothing else. But in 2021, whenever it will be possible, we consider it is your promise that you will first visit Ahmedabad.
Thank you. Thank you. It'll be my pleasure. Thank you very much.
Sure, sir. Take care and safe stay in COVID era.
Thank you very much, and all the best to everyone. Thank you. Bye-bye.
Bye. Bye. Thank you.